To politics tonight. Today we're speaking with Nigeria's Honorable Minister of Health, a key figure at the forefront of Nigeria's health policy and international engagement, at a time when big shifts are underway in the country's health sector. From strengthening global health diplomacy to empowering academic institutions, the government is pushing bold reforms. And so tonight we'll be talking about efforts to boost investment in local manufacturing, upgrade health infrastructure, and establishment of a national Medipool system to better manage medical supplies and strategies to build a new generation of professionals who can shape global health policy from an African perspective. And according to the minister, these moves are not just about fixing short-term gaps. They're about building long-term resilience and positioning Nigeria as a health leader in Africa and beyond. So let's dive into that conversation. Minister of Health and Social Welfare, Professor Mohammed Ali Pate, is on the program tonight. Honorable Minister, good evening. Welcome to Politics Tonight.
Good evening. Thanks for having me.
Thank you very much. So it has been quite a busy period for you as we see your frenetic activity almost every day. But, one development that Nigerians are quite excited about is the enrollment of a record number of Nigerians in 2024, with NHIA enrolling about 2.4 million during the entire period. In view of President Bola Tinubu's new directive to cover federal workers with life insurance, what can you tell Nigerians about the seeming effort of this administration to provide protection and subsidized care support for its citizens in that health sector?
Well, thank you, Olajumoke. Before I respond to your question, let me also clarify something that came up after we spoke the last time. I was surprised based on the response that I gave to an answer that you wanted from me regarding my state, that I was ready to serve. And I was surprised the following day to see all over the media that I had declared an interest to run. I have not decided to run or not to run for anything. I'm focused 100% on delivering on the assignment that Mr. President has granted me. That's my first priority, my second priority, and my third priority. I will do what is in the interest of the President and to support him to succeed, and for the party to succeed, as well as for our country to succeed. It's too early to make some decisions, but time will come when stakeholders and party and leaders will decide the direction that we should all go. So I just wanted to clarify that, given that we had that conversation a couple of months ago, and there was quite a bit of interest that I saw it generated. On your question regarding insurance, I think we're seeing a dramatic shift in Nigeria's trajectory to increase health insurance coverage, to offer financial protection for Nigerians in terms of access to health care, financial protection for the poorest and most vulnerable. When this administration started, there are roughly 16 million Nigerians who are covered by any form of health insurance. I'm pleased to say that we have now about 20 million Nigerians. The numbers have gone up, and that is significant. 4 million in 2 years, 16 million in more than 20 years. So if Nigeria had been increasing at the rate that this administration has been increasing, we should have more than 50 million Nigerians covered by health insurance. So we think that the trajectory that we are on will get us to where the President wants us. In 6 years' time, at this rate, we'll have almost 30 million Nigerians added to the rolls. And that will be a significant shift that will provide financial protection, enable people to afford the care that they need, and not forgetting those who are poor and vulnerable, women, children, those who are disabled, to access basic life-saving services without financial barriers for themselves and their families, and to avoid the catastrophic health expenditure that can come to families. I think that's an important policy direction of the government that is reaching everyone and will contribute significantly to the improvement in health outcomes in our country.
All right, then. But Honorable Minister, concerning the last conversation we had about whether you were ready to run for governor in 2027, truthfully, that conversation generated some controversy, and thank you very much for setting the record straight. But it looks like there is still some sort of political tension in Bauchi State as we speak. It also seems that over the course of successive elections, APC in Bauchi State has not been united. Given the current climate of political tension in your state, can calm and unity be restored in your home state?
I think it is possible. All of us leaders from the state at different levels, we have many significant leaders who are all working towards unifying the platform. I think they are also seeing the direction of the president as a unifier, and that will require us to forge consensus and to arrive at a point whereby the party will be successful. I am only one out of several actors, and we all will have to work hard to ensure we succeed. I have not decided that I will participate, run for anything, but I am very committed to ensuring that the president succeeds, the party succeeds, regardless of whether or not I decide to run. And so with that spirit, I'm sure that my colleagues will also think in similar ways and will all work hard to ensure that we succeed together.
And I'm sure you know to what extent this kind of public scuffle could go in distracting from the developmental priorities of Bauchi State, especially in critical sectors. But given your federal position and neutrality in this matter, do you see yourself playing a role in helping to de-escalate tensions or promote reconciliation between all the parties involved?
I think there's several actors, including myself, that wish and will continue to work for better or improved harmony. I know that we're all committed in terms of achieving that, and I will continue to do so. I think that's important for us and for the state to develop.
All right, then. Let's move on quickly. Prof, a few days ago, just after the Federal Executive Council meeting, you announced that President Bola Tinubu's administration has established a new body known as Medipool, which you described as a bulk purchasing organization for competitive pricing and to be a supplier of essential medicines and healthcare products across Nigeria. What is the core vision behind the establishment of that system, and what specific gaps is it designed to address in Nigeria's health supply chain?
So we know for a very long time Nigeria had been medically deindustrialized. The purchasing powers of governments has been dissipated and hyper-fragmented, and it had not been channeled towards local industries to provide quality products, but also prices. The fragmentation and inefficiency was convenient for intermediaries, but was not necessarily convenient for the population. Cost of pharmaceuticals was a barrier to many of our population. While it is not only in Nigeria, but it's a global challenge, including countries like the United States. Our own objective was to see what are the policy measures, how can we respond to reduce the cost of pharmaceuticals, to improve efficiency in that system, to guarantee quality and lower prices while stimulating domestic manufacturing of pharmaceuticals. So it is in that spirit that Medipool was established as a group purchasing organization, which is a concept that is not yet in Nigeria but has now come to Nigeria. Several countries that are similar to us in terms of structure. United States has group purchasing organizations, UK has, Singapore has, in Africa you have South Africa, Uganda and many other countries. And we benchmarked the design with those similar countries and went through the regulatory approval processes. And at the end of the day, Medipool is a group purchasing organization that will aggregate demand that is going to be activated with federal resources. For instance, Basic Healthcare Provision Fund. 20% of Basic Healthcare Provision Fund is meant to provide drugs and commodities and consumables to Nigerians that are attending primary healthcare all over this country, all the 36 states, more than 8,800 primary healthcare centers. But the purchase of those commodities had been very fragmented and inefficient. But with the group purchasing organization, PHCs can register, and Medipool will negotiate lower prices from manufacturers locally and will ensure that the logistics and supply chain is efficient and quality is guaranteed. So we are using what we call the monopsony power of government to shape the market. It is consistent with the executive order that President Bola Tinubu signed in June 2024, which provided for market-shaping interventions to stimulate local manufacturing in our country. We think it's a game changer.
All right, then.
And I believe,
Prof, is this related to the National Medical Relief Program in any way? And in terms of structure and governance, Nigerians would love to know how the Medipool will be structured? Would it operate as a government agency, a public-private partnership, or an independent body?
It is a public-private partnership co-owned with MOFI, Ministry of Finance Incorporated Limited, so that there is a public interest, but there is also the innovation and private capital. There is no public capital that will get into it, but the services it will earn from working as a private entity or a quasi-private entity. So it's a construct that is leveraging private sector capital and expertise to deliver public goods, to improve efficiency and shape markets. That is an innovative way of, within the fiscal constraint that our government has and our country has, using what is available in the private sector as well to advance our health sector's development in a way that serves our population but also creates value in our country.
And you know, when it comes to efficiency and transparency, Prof, how will the Medipool improve transparency, reduce duplication, and ensure more efficient procurement and distribution of these medical supplies across states and facilities?
It will give predictability to local manufacturers because they can have framework contracts. It will allow for price transparency and avoid the situation of multiple emergency procurements of pharmaceuticals, which oftentimes are inefficient. We believe over time, the proportion of pharmaceutical spending in relation to the total health expenditure in Nigeria should go down, and the burden on households should reduce. And the quality of the products in our market, we believe, should be getting better, using federal spending. Now, states can join, the private sector can join. There are examples that we have seen, like Kenya, where private sector also used vehicles that are organized by government. So it's a market intervention in a way that improves the efficiency as well as the quality of what is being supplied to populations.
And, you know, I trust that this system will ensure equitable distribution of essential medicines and commodities, especially to underserved and rural areas. But let's talk about another very serious challenge for us is how you've been able to address the brain drain of healthcare professionals to other countries. What more is the ministry doing about this?
I think it's a complex issue. It's a complicated question. How do you address brain drain in a world which depends on many of the health workers produced in Nigeria? We're very proud that the medical education, the health nursing education, pharmaceutical education is very good in Nigeria. That's what makes our health workers attractive. This morning in Gwagwalada, I got to know of a consultant who got a prize in urology in West Africa for an amazing performance in her postgraduate education, in her postgraduate exams. But she was recruited by a hospital in the United Kingdom. We're very proud of her. We think she'll gain experience, she'll contribute to the UK health system, and over time we hope she'll come back. So it's a bi-directional flow. We have folks that are going to go out and some that may come back in and serve. But we've increased the quota, the production of health workers, medical doctors, nurses, pharmacists. You may have seen the dramatic increase, and in collaboration with my colleague in the Ministry of Education, Honorable Minister Tunde Alaus and ourselves, trying to really strengthen the medical healthcare education in our country so that we produce more. If some leave, some will remain. Because even when they go, the diaspora remittances can contribute to our economy. They'll bring partnerships, friends, innovations, and all of those to build our healthcare system. For those who are here, we continue to appreciate them. Expanding the infrastructure, for instance. Today you saw us opening quarters for interns, for on-call quarters, the basic equipment that they needed, and other major infrastructural projects all over the Federal Tertiary Hospital that will improve the operating environment for healthcare workers. Issues of compensation are very germane to raise. And over time, we've been able to get President's approval, for instance, to look at the arrears that some of the health workers have been owed for several months. This is from the past, from 2023. And we're looking at how those will be settled in a constructive manner. We've enjoyed relative industrial harmony, and that we hope will continue so that we put the Nigerian person at the center of it and the welfare of the health workers around it, and together build a health system that will deliver what is necessary and will be resilient, taking into cognizance that some of our health workers will be needed to serve elsewhere and some will remain here.
All right, then.
And those who are outside can come back, and there are some that are coming back already.
All right, Prof. So I listened to your submissions at the IMF World Bank Spring meetings in Washington, and I remember that you referenced the $1.07 billion Hope Fund for human capital and healthcare delivery as a reference point for ways in which Nigeria is being stimulated to mobilize domestic resources and look within to solve its own challenges. Is the Bola Tinubu administration really living up to this?
Yes, indeed. That's why the president of the World Bank invited Nigeria's Minister of Finance and Minister of Health to a very high-level meeting to discuss the global health financing architecture. Because this administration under this president has been very far-sighted with the president's direction to own our health agenda, to increase our domestic financing, to crowd in concessional financing, to defragment the space, to invest in areas that matter to our population, primary health care, and to focus on human capital, including things like basic education, which have relevance to health. And we had designed HOPE, HOPE-Gov, HOPE Primary Health Care, and HOPE Education as a pact that will help advance Nigeria's trajectory in improving health outcomes between federal government and incentives to all the states. We have received interest from all the state governments in this country to participate in the HOPE project. So that is standing out as an example, as a model, and thanks to the president for his leadership, which has been applauded, of course, globally in terms of this arena, but also beyond that. So Nigeria's efforts, I think, are recognized
to be fair,
and will continue in that direction.
I mean, to be fair, these invitations and engagements look good. They sound very good. But how are we adjusting to changes in global health financing, given the new posture of the White House and other world powers who are focused on their own priorities of enhanced national defense and localized investment?
I think we're well positioned, and we expect that our partnership with the United States will remain strong. It is reset, and we've been able to position ourselves in a way that we can work effectively going forward with the United States in whatever direction that they take, but owning our health agenda. It is our responsibility to provide the services to our population. We are not begging for support. We are asking for genuine partners to meet us in delivering the services that we need. And the investments that we've made already speak for themselves. Investing in expanding primary healthcare services, insurance, tertiary facilities, and also localizing our manufacturing. What we've done by expanding the fiscal space, the president was able to provide additional resources to fill the gap in 2025 for some of the withdrawals from the bilateral support in HIV, TB, and malaria. But we're buying those commodities from entities that will come to Nigeria and manufacture those locally, because that is more sustainable. So we are substituting over time the importation of products with our own buying power, which will create jobs, provide the commodities, and transfer the technologies that will endure in our country. So I think the administration's reforms in health really positions Nigeria quite well. And all over the continent, we're having countries actually showing interest to learn from what Nigeria is doing, whether in the West African region or in the African continent overall, and including in the global community, sort of asking how Nigeria has been able to do such rapid adaptation to a very rapid, very fast-changing landscape of global health financing.
All right, Prof. Let's take a break, and when we return, we'll talk about cancer treatment and how we're faring as a nation. Please stay with us, everyone.
The government and the good people of Edo State extend our warmest birthday wishes to His Excellency, Reverend Father Hyacinth Alia, the Executive Governor of Benue State. We recognize your dedication to the development of Benue State and wish you many more years of impactful service. Happy birthday, Your Excellency. Signed, Senator Monday Okpeholo, the Executive Governor of Edo State.
Welcome back to Politics Tonight. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, is my guest tonight. And tonight we're assessing the achievements of the ministry in the last 2 years. Prof, thanks a lot for staying with us on the program. You know, early in your tenure, you broke ground on President Tinubu's latest large-scale investment, comprising of 10 oncology and cancer treatment centers across, some geopolitical zones in the country, beginning with a set of 3 cancer centers set for commissioning this month. What is the status of that project?
So in effect, there's 17 major. When we announced it, it was 16. There were 6 major cancer infrastructure and equipment establishments in the country, plus 10 major world-class diagnostic centers that were being constructed through MedServ, NSIA. The Federal Ministry of Health engaged with NSIA to accelerate these investments in the line of the direction that the President has given for transforming Nigeria's healthcare system. We've invested significant resources, 40 billion in 2024 and significantly more in the 2025 budget, through NSIA as a project manager. 3 of the cancer centers out of the 6 are going to be ready for commissioning by the end of May 2025 or immediately thereafter. The equipment have been procured, the buildings have been completed, the health workers are being trained in South Africa. That is a significant step that adds to the existing cancer infrastructure and equipment in our federal facilities. 3 others to complete the 6 will be commissioned towards the end of the year. The reason being, the devaluation in our currency and inflation created a gap in financing which we've been able to meet up in the 2025 budget. And that will make the 6 that we committed and the President approved in 2024, in early 2024, to be ready. That is unprecedented in Nigeria. Cancer as a major, fast-growing burden of our morbidity and mortality is a reason why many Nigerians travel abroad. It's a priority for our agenda, and the President has provided the resources and we're executing on it. And I believe Nigerians will soon see these world-class facilities in Katsina, in Benin, as well as at the University of Nigeria in Nsukka. In addition, ABU Teaching Hospital at Zaria, University of Jos, Lagos would also have those before the end of the year. University of Maiduguri Teaching Hospital is one that came up after the initial announcement. They had a cancer center that was flooded in September 2024. Within 6 months, we were able to pivot with the support of philanthropists like the Sir Emeka Ofo Foundation, which donated $1 million, and the resources that we'll be able to mobilize. We already have the linear accelerator brought into Nigeria and already installed at the University of Maiduguri Teaching Hospital and will be flagged up very soon, hopefully by June, and we expect it to be high-profile flag off. That will make it 7 new functional cancer treatment infrastructure and equipment that will serve Nigerians, but also potentially others from the sub-region who unfortunately suffer from this dreadful disease of cancer.
All right. Well, but Prof, we're also hearing that the $750 million African Medical Center of Excellence in Abuja will be commissioned by the President in early June. Is the 500-bed hospital fully ready for use? And what is the scale of impact that you anticipate in terms of what the new AMCE will mean for attracting medical tourists, creating new jobs, and ultimately upgrading quality of care in the country?
I think we have to acknowledge and really appreciate the leadership of the president of the Afrexim Bank, Professor Benedict Orama, who foresaw the need during the COVID-19 pandemic of a center of excellence, a regional center of excellence, and really mobilized the financing for this amazing facility to be constructed, equipped, not only to provide services, but to train medical students, very much in line with the direction of the current administration. And I believe that specialty healthcare is a global good. Not only will it serve Nigerians that spend almost 2 billion in outbound medical tourism, if we can retain some of that here, but it can attract others from outside the country to come and get world-class service. It enables us to train our professionals in best-in-class facilities. So it's an amazing development, and I think you can see the transformation already becoming evident that the health sector in Nigeria is very different 2 years on after His Excellency President Bola Ahmed Tinubu took office. And that's just the start. So imagine what it will be in 6 years from now if this track is continued.
And what can you tell Nigerians about the president's war on cancer, given the high cost of cancer treatment for the average Nigerian cancer patient?
I think cancer is a catastrophic disease.
Yes.
And we recognize that. And I have mentioned repeatedly that the president cares about the welfare of Nigerians and is concerned about the lack of affordability, particularly for the poorest and most vulnerable. And all our efforts over the last 2 years have been geared towards reducing that. So providing the equipment and the resources and the training and all of those human resources that are necessary is one aspect for access. But to make sure the affordability is there, the NHIA in 2025 has had 20 billion allocated for what is called Catastrophic Health Insurance Fund to provide relief for those who are affected by cancers, by kidney disease, like dialysis-dependent populations, as well as things like spinal surgery, the catastrophic illnesses, so that there is some succor for them. That is not enough, but at least it's a start, because it has never been done in the history of this country to have a fund for catastrophic health insurance. If those resources are fully cash-backed through the NHIA, we believe that those who are afflicted by cancers can now be able to afford even more so the infrastructure we are putting in place. And the fee-for-service that our population spends $2 billion in outbound medical tourism. A large chunk of it is for cancer treatment. People go out and do fee-for-service. If they can use it domestically, that also adds to the viability of this infrastructure that we have. So it's a very comprehensive approach. Prevention is there. We launched the HPV vaccine to prevent cervical cancer. The hepatitis B vaccine, for instance, helps with liver cancer. There are preventative efforts, pap smears, screening to ensure that we have early detection, and our health workers are tuned into that. And then for those who are unfortunate to have cancer detected that is advanced, to have the therapeutic intervention, radiotherapy. Can you believe that less than 2 or 3 linear accelerators at some time function in a country of more than 200 million people? So we are more than doubling that within just 2 years. So that's a huge leap forward in terms of the ability of the Nigerian health system to address the needs of Nigeria. It's not about just speaking about it. We're saying what we're already doing. And this infrastructure is there, and the doors will be open, and Nigerians can walk in and see them. Right. So it's not a promise that is unkept, but it's really a promise kept.
Right,
yes.
And I see that you've been heavily engaged in bilateral and multilateral negotiations from around the world, from Brazil to Southeast Asia. And as part of my follow-up on your activities, I also discovered that you've been invited to a major health sector investment mission to China in June. Now, concerning the health sector, what can Nigeria expect to gain from these new partnerships in countries like China, the Philippines, and Brazil?
So, of course, there are knowledge exchange opportunities. We share what Nigeria is doing so that other countries can learn from it, and we learn from what other countries are doing. Brazil, for example, is a federal system similar to us, so we can look at where they are. They are much richer country compared to us today, but we can learn from how they've organized their mixed healthcare system. There are also opportunities to crowd in investments that can come in and stimulate our own domestic healthcare markets. And with the value chain effort, with unlocking the value chain effort, the presidential initiative to unlock the healthcare value chain, we're seeing the bilateral engagements really bear fruits through entities, financing entities, multilateral and some bilaterals that are interested to invest in projects here in Nigeria. More than 70 investment cases already developed, and I'll be concrete. Take the European Investment Bank, for instance. They've identified already 3 major projects that they will invest in this country, one in the southwest and one in the north central. I will not call the name because that deal is being finalized. And there is a third one that is also in development for vaccine manufacturing as well as for medical device production. And there are others that are showing interest in terms of where they can put their investments. This is not resource to government. This is capital to the private sector, and government playing its role as a policy maker, but also as a regulator, as an enabler of the healthcare market to function so that it serves our health system, create jobs, and create economic value for our country, for our sub-region, and for our continent. And I think there is a lot of opportunity out there, including through the African Medicines Agency, which we've agreed to join in the treaty, which opens the African markets to Nigerian products. So this engagement that we are having globally, regionally, showcasing Nigeria, I believe is yielding fruits. And billions of resources, I think we have line of sight to them, and making sure that Nigerian private sector, our indigenous manufacturers, can have the capital that they need to grow their businesses. Technology transfer. There's an entity that bought a license from a European manufacturer, and they already have a plant here in the north central zone of our country to manufacture products that are world class. So these are things that people may think is impossible, but this administration is working hard to make sure the impossible becomes very closely, very possible, in fact, for Nigerians.
But Prof, you know, under your leadership, the BHCPF is under some bit of reform process. And for the purpose of our wider audience, BHCPF stands for the Basic Healthcare Provision Fund. It's a Nigerian healthcare initiative funded by a combination of government and private sources. How does this major counterpart funding mechanism restructure to suit the needs of Nigerians who feel that their states and localities do not prioritize health investments as they should?
You recall that we signed a compact with all the 36 states and the Federal Capital Territory in the Health Sector Renewal Investment Initiative, which is overseen by His Excellency Mr. President. States have stepped up. We have mechanisms for joint reviews, quarterly performance dialogue, learning across states from those who are performing well and those who may not be performing as well. Collectively, federal government, states, as well as local governments, ALGON and local governments have keyed in to this sector-wide approach that we are implementing. And the Basic Healthcare Provision Fund is an anchor investment of the federal government, channeling resources to thousands of primary healthcare centers all over Nigeria. And I'm very glad that in the first quarter of 2025 alone, more than 37 million visits were made to primary healthcare centers supported by BHCPF. That is an amazing number, an amazing accomplishment that we are very proud of as an administration, that we're able to reach. This is beyond the target that we have set for ourselves, meaning that Nigerians are responding to the improvements that have started to take hold in the primary healthcare system, in infrastructure, in human resources, where we've retrained at least 67,000 now frontline health workers out of the 120,000 we committed to Mr. President by 2027. So we're all on our way, despite all the prevailing challenges, and it's not easy. But by working together in a concerted manner, we're beginning to see positive results. The 37 million visits, I'm not saying 37 million individuals, but visits, which may mean some individuals may go multiple times, but at least it's a start. It's unprecedented. All right.
But Prof, you've been on record as saying that 10 million Nigerians have been affected by BHCPF support in 2024 alone. How can this reach be expanded, and in what ways?
What I'm sharing with you is that the reach in terms of services, contacts, has exceeded even our expectations. When expected, for instance, in our target, 20 million in the first quarter of 2025. I'm reporting now that verifiably 37.6 million visits to facilities supported by the BHCPF have occurred in first quarter of 2025. This is a collaboration between the federal government, states, and local governments to advance primary health care. And this is just the start. This means Nigerians are accessing preventive services, immunization services, antenatal care services. In addition, for maternal health services to reduce mothers dying from pregnancy complications, we've advanced the course of covering for cost of treatment of complications, so a cesarean section. More than 4,000 women already have had the cesarean sections and have been reimbursed through NHIA. So there is movement. It's really great that we're seeing that, and we are going to remain steady and to accelerate the momentum and continue to plead with state governments and local governments to join hands with this federal government under Mr. President and all of our partners to ensure that we transform the landscape and the health outcomes for all Nigerians, especially the poorest and the most vulnerable in our population. And I will say here, the Renewed Hope Initiative, which is being led by Her Excellency, the First Lady of the Federal Republic, as the chairman of the Renewed Hope Initiative, has rallied around this effort of the federal government. As you have seen, 10,000 per geopolitical zone being supported, frontline workers, midwives, with crocs and scrubs from a non-governmental entity complementing what the federal government is doing to accelerate this movement. So it is not only government, but civil society, private sector that will have to join hands so that we improve population health outcomes for all Nigerians over time.
All right. And you know, recently you also announced the establishment of a Pharmaceuticals and Biologics Manufacturing Institute in partnership with Swiss and Power School of Medicine in Geneva. You had mentioned in the announcement that this institute will train thousands of Nigerians across a range of disciplines, including health sector regulators, young scientists, engineers, and medical professionals. Will this become a reality, and is the funding available to bring it to life? Prof.
Yes. So Empower Academy is a Swiss-based organization that has been involved in training workers for manufacturing. If we were to unlock the healthcare value chain, we would need to have the talent that knows how to operate in industrial settings, to run machines, to control, to supervise. It's not enough that you're an engineer with a certificate of a bachelor's degree, or a chemist, or a biological scientist. You need to know how to function in a proper manufacturing plant. And because we did not have many of those manufacturing plants, the talent has been limited. And other countries are also looking for those talents. So in partnership with Empower Academy, we decided to reach out and construct an Empower Academy, Empower Health Academy here in Nigeria, a finishing school for our youth so that they can be trained in the manufacturing sciences, so they can be employed and drive further the industrialization that we're seeking as part of the Renewed Hope agenda. And the project is in 3 phases. The first phase is in the next 3 months. The virtual format will be flagged off. There will be a portal, and it will train those who are ready and who apply, and the funding for that has been secured so that we start immediately. That is enabling Nigerians who are interested in going into manufacturing to begin to be trained. The second phase, in 6 to 9 months, is the modular part and the simulation part, whereby there will be mobile training platforms which will allow folks to come in and see the plants and be trained in how to operate this machine or that machine. And that is not being done for the first time anywhere. It's been done for the first time here in Nigeria. Empower Academy has experience with that. The fundraising for that by Empower Academy is already well underway, and they're raising some of those resources. In the longer term, in 12 months' time, a physical Empower Health Academy in Nigeria, we expect it to be well on its way to being constructed. That fundraising is a much larger amount, and that is a joint effort between ourselves and Empower Academy to raise those resources through various channels,
talking about fund,
private sector and others. Yeah.
Right, so talking about fund,
yes.
I mean, once the Empower Nigeria Institute comes to fruition, I think it will certainly boost investor confidence that, we have the manpower to run our health-affiliated industries and service centers. But we know that financial support for new investors is critical. The presidential initiative on unlocking healthcare value chains has said it has secured €1 billion in financing support from the European Investment Bank and $1 billion from Afrexim Bank. Is this true? And if so, what impact do they have on getting new industries built and established in the country for the benefit of Nigerians?
I think the EIB investment is there. I think that financing is not the most important limit that we see. It's the readiness, the investable projects, the due diligence that confirms that, and then the resources made available. Investors are looking for returns. Obviously, there are a combination of ways that they finance ventures, whether it's debt or equity. And I believe that as we are shaping this environment and identifying those resources, we're seeing uptake. I mentioned the EIB looking at 3 major investments that would be consummated. Afrexim, for instance, is at the term sheet level for 3 other investments, which will be signed, we expect, in the first week of June here in Nigeria. I will not call the names to preempt what is going to be announced when the term sheets are signed. So what we have proven is that Nigeria is an attractive investment destination. The macro fiscal reforms that the president has led, the bold reforms that he has done, the stabilization that we are beginning to see, despite the global challenges, and imperfect as it may be, our business environment, has signaled reason for confidence by investors across sectors, but including health.
All right.
This is not limited to health. We're seeing the attraction. Nigeria is a good investment destination, and that's just the beginning. And that will fuel further growth in our economy, which is already growing at a very healthy rate, as was recently announced by the World Bank.
All right, then. Great vision, Prof, and evidently the works are there to show for it. Thank you so much for speaking with us, and thank you so much for the updates. We wish you the very best. Thank you so much. Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Thank you so much for your time. Thank you.
Thank you for having me.
And thank you very much for watching. That marks the end of today's episode of Politics Tonight. But before we go, let's tell you that the views and reactions of our resource persons are theirs and have no connection with TVC News. Meanwhile, you can watch the repeat broadcast of this episode at midnight. Get in touch with us on our social media handles, Facebook, Instagram, and X at TVC News NG and at Olajumoke using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News NG. I am Olajumoke Olatunji. Good night, everyone.
It's another season of cowbell